Next, we'll hear from Justin. He is the harm reduction support specialist for Summit County Public Health. He's going to share his story with us tonight.
Thank you. Hi, everybody. Thank you for coming out. My story starts very young. I got migraines, still do, but when I was in elementary school, I started getting very bad migraines, debilitating, hospital grade. Never really been diagnosed, don't know what it is. Would happen at least twice a month. Long story short, when I was 14, they started getting bad enough that I needed to go to the hospital, or I needed something. So, in one particular event, I asked my dad to take me to the hospital, and he ended up, this was the 1990s, by the way. I'm old, dated myself. So he called the hospital first, he called the ER, asked if there was anything we could do for me before bringing me in, because it was late at night. Anyway, the doctor prescribed hydrocodone, which is Vicodin, over the phone to a 14-year-old. Anyway, my parents are great people, very Christian, care about me, everything. They had no idea. I don't blame them at all, but they allowed me to have control of the medication. So anyway, take one, didn't really help, took two, started to help, took three, really helped. And that, yeah, fine, okay. Yeah, so that basically gave me a taste at 14 years old of what a pure synthetic opioid high could be. That started off a long process of trying to find Vicodin everywhere I could find it. You know, parents' medicine cabinets, friends' medicine cabinets. That led on to trying to get it from doctors, doctor shopping. That was the first wave of the opioid epidemic when OxyContin started hitting the streets, you know, because it wasn't addictive and you prescribed it for anything, right? Anyway, so yeah, started taking OxyContin, buying it off the streets, moved on to smoking it, snorting it, and then to IV injecting it. That became very expensive because of the regulations that came into effect at the beginning of the second wave of the opioid epidemic, which is when none of us could afford, oh, I'm so sorry. None of us could afford the OxyContin anymore, so we went to the streets. We started purchasing heroin, black tar heroin off the streets. And that was my last phase. I was an IV heroin addict for a solid decade after the pills until my early to mid 30s. And I just got so tired of being on the streets, not having money, food, housing, comfort, no comfort. So I decided through, you know, friends and other resources to try Suboxone. My friends were on it. It was something that seemed to work for them. So I gave it a shot. Didn't do what it needed to do. Didn't hit the spots necessary in my brain to, you know, keep cravings at bay. So we're talking about like 9 or 10 solid attempts and relapses that addiction. But then I found methadone. Methadone, once I got to a proper dose, had great caregivers who allowed that to happen, allowed me to get to where I needed to get to truly be at a therapeutic dose. And because of methadone and the people who provide it, I have spent the last 7 years building a life. 4 years ago, down in Denver, I got out of a long-term relationship that was very bad. It ended up in Summit County. was working short-term rentals and then basically got asked to apply at public health, and get into the harm reduction world. And, I think that people like me who have experienced that world, who have truly lived in it and who have somehow managed to reinsert myself back into, I guess, real, you want to call it, the life that we're all supposed to be living, you know, working, contributing to society, having good relationships, friends. All of that, I believe, has been possible because of methadone. Up until now, I've been driving down to Denver. Well, I get monthlies because I've been on it for a while and I follow the rules and such, but so twice a month because there's diversion checks and then you get my actual medication. But I have to drive down to Denver to get it. And I know people who are coming to Grand Junction, people who, you know, come down from Wyoming. I mean, it's getting this in Summit County is huge. It's like one of the final pieces of the puzzle for addiction treatment for us. So yeah, that's my story.
Thank you so much, Justin, for sharing with us.